Ampyra is also known as the walking pill for multiple sclerosis. It is not a disease-modifying therapy. With this, I mean the medication is not going to impact the course of the disease. However, it's a medication that may improve function in patients with multiple sclerosis. The mechanism of action is fascinating. What the medication is actually doing is working with one channel called the potassium channel that we all have in our body, in our nerves. And by doing that, it helps to keep the potassium inside the nerve cells, and by doing that, improve the conduction of the cells, meaning it will improve the function of certain pathways that we have in the brain. The most commonly studied pathway is the one that allows us to walk, and that's why in the clinical studies, the medication was studied by looking at how patients with multiple sclerosis can walk in terms of distance and also how fast they can walk certain distance. And patients receiving Ampyra were found to be able to walk up to 25% faster than patients receiving placebo. The effects of the medication will go away as soon as the patient discontinues the treatment. It may take up to 2 weeks to start seeing any results, and it's always important for patients to identify one outcome that they're going to be measuring in order to understand the efficacy of the medication. I often recommend patients to look at certain distance in their house, in their neighborhood, for example, 1 block, and try to measure how long it takes to walk 1 block. Do that before the medication, start taking the medication, and repeat that exercise 2 weeks after being on the medication, and try to see whether there is any meaningful difference between the two measurements. In addition, we often do that in our clinic. We measure a 25 feet time walk in order to understand the clinical efficacy of the medication. Because the medication works in the nerves and in the brain as well, common side effects include anything that will increase function of the brain and the central nervous system. For that, patients may often have anxiety, insomnia, difficulty with mood swings, as well as seizures. Seizures occur in less than 1% of the cases, and is often seen in patients who either take more medications or more often than what is prescribed, patients who had history of seizures, or patients who have problems in the kidneys and the body cannot eliminate the medication properly. The formulation that is currently approved is a twice-a-day medication, and we often recommend to take it 12 hours apart between 2 doses. And in order to mitigate the potential risk of insomnia, we often recommend patients to wait at least 6 hours after the second dose before going to bed. It's very important as take-home message that if you're considering this medication, talk to your healthcare provider and carefully review all the medications that you are taking to make sure there are no interactions, as well as a good history in terms of a previous history of seizures or family history of seizures as well.